So, Obamacare. It's hard to tell truth from fiction when it comes to Obamacare. So let's just start by talking about the different ways that a healthcare system could be set up. One approach is to have the government actually provide the healthcare itself. All the doctors and nurses would be government employees, all the hospitals and the equipment would be government property, and it would all be paid for by taxes. And this is actually how the healthcare system works in Britain and in Canada. That is not what Obamacare does. Another approach is to have the government just provide health insurance. All the hospitals and doctors are private and they compete with one another for patients, and the government just pays the bills of those patients. This is the way the healthcare system works in France, and also this is the way Medicare works in the United States for people over age 65. Obamacare doesn't do that either. So what does Obamacare do? Basically, it makes it easier for individuals to buy health insurance for themselves on an open market from private health insurers. Let me repeat that. Obamacare makes it easier for people, many of them with low income or pre-existing conditions or who currently don't have insurance, to buy health insurance for themselves on a marketplace of competing private insurers. Yeah, so that's what all the crazy has been about. There are basically two ways to get private health insurance. Of those with private health insurance, 90% get it through their employers in what's called the group health insurance market. If that's you, Obamacare won't really change your health insurance much at all. The other 10% of people with private health insurance get it on what's called the individual market. They go out and buy health insurance the way most of us would buy auto insurance. Until Obamacare, that individual market was all kinds of messed up. If you had any sort of health problem in your past, either you wouldn't be able to get that issue covered, or you'd have to pay totally unaffordable premiums for health insurance. Obamacare requires insurers to cover pre-existing conditions, and it requires them to charge everyone of the same age the same premium. The problem is that people could just put off buying this guaranteed insurance until they get sick. And without healthy people paying into the system, those private insurers would go bankrupt. That's why Obamacare has the mandate. And no, the mandate is not eating wings at the sports bar with your bro. It's a requirement that all people buy themselves health insurance if they don't already have it through their employer. Obamacare sets up exchanges, which are basically online shopping malls for health insurance, and it also subsidizes people who can't afford to buy health insurance on their own. You may have heard that employers have stopped hiring workers because of Obamacare. While Obamacare does require employers with more than 50 workers to provide their employees with health insurance or pay a penalty. But 95% of those large businesses already provided their employees with health insurance. So if this problem is happening at all, it's got to be in those remaining 5% of businesses. You may also have heard that employers are planning on dropping insurance for their employees and just paying the penalty. But if that happens, then workers can simply go on the exchanges and buy health insurance for themselves. Instead of their insurance premiums coming out of their paycheck, they'll come out of their checkbook, again with subsidies for the low income. So how is this all going to play out? Well, in 2006, Massachusetts passed a reform that was identical to Obamacare. And the state economy was not destroyed. They still have jobs. They still have employers. And the number of uninsured people in Massachusetts is way down. People with pre-existing conditions can get coverage, and most employers didn't even drop coverage for their workers. Obamacare won't be perfect. There will be problems and there will be unintended consequences. But let's keep in mind that the US healthcare system before Obamacare was one huge steaming pile of unintended consequences and problems. And who is EconGuy? I'm Patrick Walsh. I'm an associate professor of economics at St. Michael's College near Burlington, Vermont.